Well, good morning. My name is Adrian Harewood, and I am an adjunct professor in the Department of Journalism at Carleton University. I'm also the co-host of CBC Ottawa News at 6, the public broadcaster's local newscast here in the nation's capital. I'm honored to be serving as the moderator for this morning's session we're calling the Underreporting of COVID-19's Impact on Racialized Communities. COVID-19 has upended our world in ways few could have imagined a short 10 months ago. The pandemic has provoked the greatest global public health crisis in over a century. Its effects have been catastrophic. To date, nearly 42 million people around the world have contracted the virus. Millions have been hospitalized. In total, nearly 1.5 million people have died. Ordinary working people have seen their livelihoods disappear. According to data from the International Labour Organization, or ILO, working hours fell 14% during the second quarter of 2020, equivalent to the loss of some 400 million full-time jobs. Many have lost their homes. To contain the pandemic's spread, economies have grinded to a halt. COVID-19 has become one of the world's most successful and destructive colonizers. When COVID-19 first began to take root, the general public was told by pundits and politicians alike that the virus was the great equalizer, that it didn't discriminate, that it was colorblind. But on the ground, a different picture was emerging. We know now that in Canada, the US, and also in Britain, racialized people have borne the brunt of the disease and are suffering at a rate disproportionate to their numbers in the population. In Toronto, Canada's biggest city, the data tells us that Black, Indigenous, and other people of color make up 83% of reported COVID-19 cases. In the US state of Michigan, African Americans comprise 14% of the population, 33% of the reported infections, and 40% of the deaths. In Britain, Black people are more than 4 times more likely to die from COVID-19 than white people. Pakistanis and Bangladeshis are more than 3 times as likely. The racial disparities are stark. And it should be noted that we're experiencing COVID-19 in the aftermath of the police murder of George Floyd and the rise of the Black Lives Matter movement and a global anti-racist movement. We know that media has a significant impact on affecting discourses and shaping public opinion. What are the stories that have been told about COVID-19, and what does that reveal? How have the stories been told? What are the stories or angles that have been missed, ignored, or obscured? Whom have the stories being told been for? How to explain the underreporting of COVID-19's impact on racialized communities? To answer these questions, we have assembled a stellar panel. Beverly Bain is a Black queer feminist, anti-racism, anti-capitalist scholar. She teaches in women and gender studies in the Department of Historical Studies at the University of Toronto, Mississauga campus. Beverly Bain teaches and writes in the areas of Black and diasporic sexualities, violence against women, transnationalism, and anti-capitalism. She has written for the likes of phys.org, The Conversation, newsone.com, and also the Buffalo Bulletin. Sharie Pradkar is a Toronto Star race and gender columnist. She was the 2018-2019 recipient of the Atkinson Fellowship in Public Policy. Just last August, she was appointed the Star's first internal ombudsperson, a role the Star described as providing a safe place for BIPOC journalists and all journalists to express editorial-related discrimination and bias concerns if they don't feel comfortable bringing it to their manager directly. She has been a journalist in Bangalore, Mumbai, Singapore, and Toronto. Danielle Kilgo is the John and Elizabeth Bates Cowles Professor of Journalism, Diversity, and Equality in the Hubbard School of Journalism and Mass Communications at the University of Minnesota, Twin Cities. Her research examines the interaction among social movements, social media, and journalism. In 2020, she received the Lillian Lodge Copenhagen Outstanding Junior Scholar Award. Danielle Kilgo currently teaches about race and gender, diversity, and mass communication. And finally, Ashton Lattimore is the editor-in-chief at Prism. Ashton is a longtime editor and writer whose work focuses on race, culture, and the law. Her writing has been published by the Washington Post, Slate, CNN, Essence, and other outlets. Prior to joining PRISM, she was senior writer and managing editor at the University of Pennsylvania Law School, and previously was the lead editor at News One. Ashton is also a lawyer. She represented Pennsylvania's governor in the lawsuits that successfully challenged the state's congressional map as an illegal partisan gerrymander, resulting in the implementation of a new map in time for the 2018 election. So that is our panel. And the way things are going to work today is each panelist will speak for 10 minutes, and that will be followed by a discussion that I will facilitate. I will pose a number of questions, and then we will also invite questions from our audience. So I'm just going to ask Beverly Bain, if you can get us started, and welcome to you all. Beverly, I think you're muted.
Okay. Thank you, Adrian. Thank you all. It's really a pleasure to be here on this panel with all of you. And thank you to the School of Journalism and for organizing this, I think it's 2 days of conversations around journalism and the pandemic. As probably, and I think it's important for me to declare upfront, I am not a journalist. I'm a social scientist and I teach in social sciences and humanities. So I'm coming from a perspective of speaking to the larger context and the ways in which I understand how the pandemic has shaped Black and racialized lives and Indigenous lives in this context, and how the news actually reflected how I understood or saw the news actually reflecting, very much a lot of the power dynamics in terms of how the state and how our nation was put together. So that's the perspective I'm coming from. So I'll begin. I was struck by the discourses of we are all in this together, stay at home, and social distance that shaped the reporting of the coronavirus in its early stages of the pandemic. Not because I thought they were not good advice to help stop the spread of the virus, but that it subverted an entire Black, racialized, and Indigenous population to a collective we that consolidated the Canadian landscape as white. And in so doing, I must add that what it also do is created an invisibility of those populations as not existing within the landscape. The first, month of March and of April of reporting on the pandemic, what we saw visibly were reporters, were conversations about who were heroes, all reflecting a white discourse, a white frame in terms of what the nation stands for. So when we said, when the media and our state were using medical professionals were using the "we are all in this together," it was really a consolidation around whiteness. The reporters on all of the main news channels were primarily white. The medical professionals, except Dr. Tam, Chief Public Health Officer of Canada, were all visibly white. She was the only scientist, Asian, whose expertise on the handling of the crisis was questioned by a conservative MP accusing her of protecting China's interest over that of Canada. So we see within this whole conversation and without the way the discourses and the way in which the media also took this up without question was the way in which Dr. Tam was called to task for not actually being able to provide the kind of consistent kind of information, which nobody was able to provide at that point, actually, nowhere, not in the US, not in Canada, yet she was somehow expected to be so clear, succinct, and knowledgeable. And the fact that she were also, like everybody else, working through what the parameters should have been. And because she was Chinese, she was immediately linked to some sort of underhanded implication in being in protecting China's interests, as opposed to being more or less protecting that of Canadians. So we were witnessing refrains and discourses on the need to consolidate and safeguard the nation in mainstream reporting that was silencing the historical and socioeconomic inequalities, racism and colonialism that shaped this nation, which would mean that some of us would be more at risk of contracting the virus than others based on these inequalities, right? We know that poverty, homelessness, creates situations to illness. And we know that statistics show, not just in the US, because again, Canada tend to look around for the oppression of Black people and racialized people elsewhere other than here, when in fact, Blacks in particular live in underhoused, underserved communities in this country, in Canada, in other parts of Canada, and experience racism and other forms of oppression on a day-to-day basis. We know that during this time, Indigenous communities were being wiped out by the coronavirus, yet the news was not reflecting any of that, even though those things, there's a pre-existing history here of Indigenous communities being wiped out economically, sociopolitically, environmentally, which means they would be predisposed to the coronavirus even so. So there is, you know, an intellectual and a socioeconomic political basis to already understand that this is actually inherent in the construction of this nation. So those who were converted to essential workers, meaning those who were the outsiders, became insiders in this moment, through these discourses were primarily Black and racialized women who were frontline workers in health facilities, cleaners, and grocery clerks. Yet race only entered the frame of reporting in the context of danger, i.e. the yellow peril, that being the linking of the coronavirus to Wuhan, China, to Dr. Tam, and frontline Black and Filipino PSWs, and caregivers in health institutions who were blamed for the spread of the virus in those institutions. While the media did not create these discourses, it reinforced them in its reporting, which is always shaped as objective and factually based. In other words, outside of power. Michel Rolfe Trouillot, one of the most prominent Haitian scholars, tells us that facts are not created equal. The production of traces is always also the creation of silences. In other words, facts get produced within particular socio-historical contexts that produces particular groups of people, and in this case, Black, racialized, and Indigenous populations as either belonging, non-belonging, as disposable, or already dead. The universalizing, exnomination, and essentializing frames that shape and reinforce media reportings of the coronavirus could only make legible the presence of Black, racialized, and Indigenous populations through public health discourses linked to social control and surveillance. So during this particular time, we were seeing that communities in Nova Scotia, for instance, Nova Scotia, Canada, the town of Preston was actually targeted as a source of, constituted as a source of social health and social problems in the media and by health officials, right? Which were again taken up in the media and actually reinforced through their own frames that, and Nova Scotia has already have a history of its Africville community being destroyed, and also constituted as a social health, public health problem, which is why in the first place it had to be taken apart, because the nation, the city chose to establish, a disposable company, a chemical company, and other kinds of infectious institutions, infectious buildings and companies in the middle of Africans' livability, in the middle of their communities, thereby infecting Blacks in Nova Scotia. And as a result, this legitimized their need to remove and to tear that town down. So we see that this whole thing around social, social control and social and public health discourses are tied to the body of Black and racialized people and Indigenous people as bodies that are dangerous, bodies that are vectors, bodies that are disposable, right? In an article I penned with two of my colleagues, Ronaldo Walcott and Omishori Dryden, in April of this year, we stated that public health has historically been an extension of policing for Black people that has positioned us as suspicious and nefarious in our actions and movements. In our current state of emergency, this union of policing and public health has led to more Black people being arrested, detained, and physically restrained. And during this time, Black people were actually being carded, stopped. People who were walking with their families were being questioned. We had a man and his family in Ottawa who happened to be in a park, didn't realize that you couldn't be in that particular park in that space. And when he asked why he was being stopped or why he was interrogated, he was thrown to the ground and beaten by police. We had young Black people in Nova Scotia. We had also where white individuals in society became those who started policing the bodies of Black people, in particular, homeless people and racialized people, as part of their participation and implication with the state agenda to maintain whiteness as purity and to also denigrate Blackness and racialized bodies as that which is infectious and need to be surveilled and controlled. Yes? So the current rules around movement put Black people at risk, more vulnerable to intensified policing, including carding and street checks, when in public and potentially exposed to the virus at work. For those of us Black and racialized scholars and healthcare researchers and advocates, we already knew that Black and racialized frontline workers, particularly women, were being infected. Yet on April 9th, during a public conversation with the Preston Community COVID-19 response team and African Nova Scotian communities, Nova Scotia's Chief Medical Officer, Robert Strang, said now was not the time to focus on how the social determinants of health and long-standing issues are impacting Black communities during the pandemic. He said we can focus on these issues later, right? So therefore, our lives do not matter. On April 10th, Ontario Chief Medical Health Officer David Williams said, as the province fights to contain the coronavirus, this aggregated race-based data is not necessary. Whilst challenges were being made and articles being written by Black community scholars and researchers on the need for disaggregated race-based data, the mainstream media was reporting about the high proportion of infections of Blacks and Latinos in the US, without making any connections to the similarity of the situations of Black here in Canada. The insistence of Blackness not here, but elsewhere, framed through discourses of criminality, social control, surveillance, disease, and death, in the context of the Canadian nation, continues to shape the reporting of mainstream media. The media cannot plead innocence or naivete around its reporting. This is in itself an exercise of power. Those of us who view the news must also not be naive in assuming that the news comes to us devoid of socio-historical, political, economic power relations, imbued with racial, gendered, and cultural biases. We must begin to construct these hegemonic frames of news reporting to allow for multiple narratives and historicities to come through. For journalists, that would involve re-examining concepts such as objectivity and facts, and how they are constituted within socio-historical political relations of power that are racialized, that are gendered, that are, colonized. This would insist that the lives of indigenous peoples and racialized people are not always positioned through discourses of victim, vectors, terrorists, criminals, but will insist on reporting that reveals how this nation has been constituted through white supremacy, settler colonialism, slavery, and migrant labor. This would allow, again, for multiple narratives of resilience, survival, care, sustainability, and livable lives of marginalized communities to be centered in times of a health crisis, such as this one, the coronavirus. Thank you very much.
Beverly, thanks so much. Thank you for getting us started. I'd like to ask Ashton Lattimore to go next. Ashton.
Sure. Thank you, Adrian. Really excited to be here and honored to be on a panel with such a distinguished group of folks. So the perspective I bring as a Black journalist working in the United States. So let me just start with the top line numbers. In the United States, COVID-19 is absolutely a racialized crisis. There have so far been 223,000 Americans who have died, and Black and Indigenous Americans have the highest death rates in this country, with Black folks being the highest at 2 to 3 times the rate of white and Asian Americans. And last week, the CDC reported that nearly all of the children and teenagers who've died from the disease have been Black and Hispanic. So here in the US, among pretty much all quarters of the media, the reporting has reflected those numbers at the very least, the racialized impact of how the disease itself is moving through our population and moving through communities of color. But I want to look for a moment beyond the numbers and kind of zoom out to examine the larger narrative. And I think to do that, it's useful to put this in context of the response to and reporting on other racialized public health crises in the United States and how they were reported on and treated by our government. So, going back to the HIV/AIDS epidemic, which was largely ignored by both the government and by mainstream press in the early stages, and then largely neglected, except by the Black press, the queer press in the United States. And then also looking at kind of the other large racialized crisis that the United States has faced, which was the substance abuse crisis in the 1980s around crack cocaine, which instead of being treated as a public health crisis, was largely examined and responded to as a criminal justice issue and reported on as such, treated as a problem to be addressed by punishment rather than treatment or care. In contrast to the current opioid crisis, which is our other kind of large public health crisis that we're facing right now in the US, which is effectively a whiter crisis than the crack cocaine substance abuse public health kind of pandemic, and which has been met both in reporting and in government response with compassion, and accompanied by compassionate reporting that humanizes the folks who are at the center of that public health crisis, that examines kind of the care and the treatment options that they need, that looks kind of at solutions, it looks at the resilience of their families. So coming into that context, the COVID-19 pandemic's unique because while it is racialized in its most severe impact in the United States, the disruptions to everyone's lives, those have been felt across the board, across racial and socioeconomic lines, although not to the same severity. So because of that relative universality, the crisis itself has swept in the media industry and the people who make up the media industry in a way that's personal. That wasn't necessarily the case for the HIV/AIDS crisis, for the crack cocaine pandemic, and other kind of racialized public health crises. So right now, narratively, we're seeing a really interesting mix of the kind of compassionate, human-centered reporting, often across racial lines, that we saw with the opioid epidemic. And at the same time, a lot of the sort of hyper-individualistic, shame-based personal responsibility narratives that showed up more heavily with HIV, AIDS, and crack cocaine. So that's where you're getting a lot of reporting about things like mask shaming, pre-existing conditions, kind of blaming people for having those, blaming people for having comorbidities that put them at greater risk of contracting and possibly dying from COVID-19. And all of those things are showing up in kind of a racialized way, where especially a lot of the pre-existing conditions that put people at more significant risk of death or serious illness are also disproportionately affecting people of color throughout the country. So I think coming in with those narratives, the press has absolutely captured the racialized impact of the numbers, of the high numbers of Black, Indigenous, and people of color who have been affected by COVID-19. The high numbers of folks who, or of children who've been affected by it, the numbers of people who have lost their jobs. But I think what is missing in many outlets are the racialized and the gendered impacts, not just at the public health level, but the follow-on effects of the pandemic. So this isn't just a public health crisis. It's a workers' rights crisis. It's a family care crisis, an education crisis, a crisis in gender justice, electoral justice. We're in the middle of an election right now, and criminal justice. And in the United States, race intersects with all of those issues in really insidious ways that are often missed. So what we've done at PRISM is try to focus our reporting there on those intersections, centering the people who are impacted and how their multiple identities, racial and otherwise, are complicating this moment for them. So I can just run through a couple of examples of the kinds of stories that we've been working on and the reporting we've been doing that isn't as widespread around the rest of the media. So around workers' rights, there's been lots of discussion of essential workers, lots of reporting on essential workers, but less widespread reporting of the demographics of many of the fields that are most impacted. So when you're thinking about meatpacking plants, were some of the most dangerous places to be with widespread outbreaks, around the country, particularly North Carolina, Minnesota are some places that we've seen significant outbreaks. These plants are largely staffed by immigrants, Black and brown immigrants, often Latina women, many of them who are undocumented. So we've been reporting on kind of the risks that they're facing and the risks that their families are facing by proxy because of the workers' rights issues that are present within these places, the lack of personal protective equipment, the lack of the ability to take time off if people close to you or you yourself turn out to be infected, the lack of accessible testing, and how that's showing up in their lives and what they're choosing to do about it, which in many cases is speak out against the people who they're working for, against the companies who are putting them at risk this way. And it shows up in a similar way for farm workers who are largely Latinx people, often, on the West Coast, who are, we understand them as essential workers who are significant because, they're putting food on the table of the rest of America, the implication being white America, but really reporting on how this is affecting them and their lives and their families. And again, what they're choosing to do about it in response. Following on from workers' rights and getting a little bit into the gendered and racialized aspect of this, the issue of childcare workers has also been something that has been covered at a high level. There's been reporting on how the childcare crisis is affecting women broadly, with women falling out of the workforce at higher rates. By this point, I believe 800,000 women in the United States have fallen out of the workforce or been forced out of it, I think is a better way to describe that. But less so on how women of color specifically are faring, given the added pressures that we're facing. And that's both women of color who, as working parents, and women of color who are disproportionately, who makes up the people who are working in the childcare industry, who are facing job losses, closures of childcare centers and early childhood education, and again, a similar lack of personal protective equipment, a lack of time off, and are facing all of these things for essentially poverty level wages, which has been true since before the pandemic. And for working parents, Black and brown women have often lower paying jobs, less flexible jobs, more likely to live in childcare deserts even before the pandemic, and often are more likely to be single mothers who don't have partners who can equitably split the load of childcare to reduce the impact on the mother's career, which puts the entire family at economic risk. So that's one of the ways where, workers' rights, gender justice, and racial justice are all intersecting in the lives of these women, whether they're working mothers, childcare workers, many people are both. and has largely gone unreported. And turning to kind of another big racial justice area in the United States, but certainly not the only one, there's criminal justice, where we've seen our prisons and jails are largely stuffed with Black and brown people. And prisons and jails are also sites of extremely high rates of transmission. So that's one of the ways where, you know, the race impact of COVID-19 is a direct result of policies that have been in place for, I think it's fair to say, centuries, you know, if not at least decades, of incarcerating Black and brown people at much higher rates than other people. And as a result, you kind of get them, you know, warehoused in places where they're put at grave risk of many public health crises, but this one being kind of the most acute in this moment. And immigrants who are also Black and brown folks in the United States in detention centers are being similarly affected, being placed at a high risk. We're not seeing a ton of reporting about that, you know, outside of kind of the usual quarters, you know, like Prism and other outlets that focus on Black and brown people. But within the detention centers, people are now being asked to, you know, choose between being separated from their children so that their children can leave these highly infected detention centers, or staying together, you know, but at high risk of transmission. And there, you know, a number of ways that this is showing up across the country. And a huge one, apart from the ones I've already mentioned, is the electoral justice aspect of it. Our electoral system in the United States is highly racialized. Voter suppression was already highly racially targeted before this moment. And what we're seeing now is that the pandemic has offered new levers of supporting suppressing the votes of people of color, in a way that's not being reported on with quite that level of intersectionality. So we're getting lots of reporting across the press about voter suppression, and lots of reporting across the press about the pandemic itself and how it's reflected in communities of color, in terms of numbers, but not necessarily how those two things are intersecting, especially for Black and Indigenous people. So as I'm sure a lot of folks are aware, we've largely shifted in many places to vote by mail in the United States as a result of the pandemic, you know, for safety reasons, to keep people not having to go physically to the polls as cases are spiking around the country, you know, in places where it might be hard to social distance, long lines, et cetera. And this has been a shift that's largely been lauded in a lot of quarters, rightfully so, because it's, you know, a shift that's positive for many communities. But at the same time, a story that's been missed is how for Native American communities, the widespread shift to vote by mail poses a risk, because many of them have a lack of residential addresses, or may live on reservations or in rural areas where the mail is not delivered or picked up, in a reasonably fast way, where you can trust that you're going to receive your ballot, or that your ballot's going to be received in time to be counted. And at the same time, the New York Times just reported that mail-in ballots that do manage to get in are already being rejected, with Black and Hispanic people seeing some of the highest rates of rejection. So that's, you know, the election story, lying at the intersection of COVID-19, of racial injustice in the United States, is a really significant place where I think there's been a lack of understanding how these issues are stacking on top of each other for people of color throughout the country. I could go on for a while because I'm sure there are plenty more examples. But I think the short version of it is that in the United States, the racial impact of COVID-19 is spinning out far, far beyond death rates and case numbers. And especially in the case of the election, our very ability to elect a government that might help us out of this crisis is being impacted in a racial way by people of color being effectively prevented, deterred, suppressed from exercising our right to vote, in a way that might actually generate some added safety for us. So I think what all of this illustrates, the presence of all of these stories, you know, in our own reporting, and the relative lack around the rest of the media, except for in other kind of identity-based outlets, and other outlets led by people of color, really illustrate the importance of looking beyond the numbers, and really lifting up the stories of how people of color are not just being affected, passively affected, but also how we're fighting to survive, to thrive, to keep each other safe in this moment. And a lot of what that looks like is, some of it is literally just speaking out to the press and exposing these problems where they happen. A lot of mutual aid, there's direct action, and a lot more that's happening. that's the kind of reporting that we've been aiming to do, and that I think we need to see more of throughout the rest of the media, nationally, to make sure that we're not missing the full scope of the racialized impact of the pandemic. Thanks.
Ashton, thanks so much. I'd now like to ask Danielle Kilgo to give us her presentation.
Thanks for being here this morning and inviting me. I'm really honored to have this opportunity. So most of my research explores problems of media representation related to marginalized communities in the United States. And I think it's just important to start with just a note about the method of my research. I'm a critical scholar by heart, but my critique of journalism is really backed by mostly quantitative empirical data. In most cases, I count narratives or frames in news coverage to create at least a data set that helps me understand journalistic output, what the narratives are. And then I use surveys and interviews with journalists and audiences to make more sense of the production methods and the impact on society. And then most of my research has found that racism continues to have a huge systematic influence on the institution of journalism in the States, and it serves as a vessel for status quo protection in our larger society. Sorry. Let's say, so this notion really reifies what Dr. Bain has already beautifully articulated, so I'll stop talking about that. I have found this status quo protection in the case of coverage of anti-racism protests in the US, coverage of police violence incidents in the US, and racialized medical crises like the Ebola crisis and the opioid crisis. And today's discussion about racial disparities in COVID-19 shows that the same struggle still remains. And so today I just wanted to talk about a few big data trends that we can see by exploring article counts and keywords across news organizations and the digital coverage, so it's coming from their websites. And just as a disclaimer, this doesn't just come from mainstream news organizations, it also comes from these digital native sites like BuzzFeed News, ethnic media, alternative media, and aggregators. And I use a database called Insights from NewsWhip, and it tracks just all of the unique URLs from tens of thousands of news organizations in the US. And what I did was pull coverage that was related to coronavirus and COVID-19, and I had to say it at the beginning of the article, so it appeared in the headline or the first paragraph or the metadata. And so from that, just sort of weighing down all of the articles that were created from January 1 until yesterday, I pulled about 5.8 million articles that were about coronavirus. That's actually 5,826,928 articles, a whole bunch. And then what I did after that was run a set of keywords that corresponded with the number of times journalism articles mentioned things like racial disparities or racism generally. And my research notably shows that journalism has a real problem with these words, using these words. I also looked for a number of articles that emphasized COVID-19 in specific groups. So I ran individual searches for Black Americans and related words that we would call them. So Black people, African Americans, Native Americans, Asian Americans, and Latin Americans. And I just want to talk briefly about what those look like in raw numbers and how we can understand what the coverage looks like in peaks of time. And before I share my screen, I just want to, one reminder, there are 5.8 million articles about coronavirus. And let me see if I can get this to share. So let's start with the coverage that specifically discusses coronavirus and racism generally. So just saying that it has racism in the title or at the beginning of the article. Here I retrieved 13,382 articles that we know generally include references to racism or racial disparities. That's 0.22% of the total articles. The most viral coverage from that 0.22% primarily discussed racial assaults against Asian and Asian Americans. So here's this charted. And for each of these keywords that I looked, you can see sort of the major tipping points over time. And this general reference to racism and COVID-19 is there in that green line. You'll really see two peaks that I think are telling. These peaks represents time when the keywords received the most coverage. And the first peak is this critical point of the shutdown in the US when initial deaths are starting to be reported. So we've shut down, we have these initial deaths, and we're finding that people of color are being hospitalized and dying from the virus at a much higher rate than white people. And then there's a second peak in early June. You see that in green again, and it's the highest peak that we see overall. And as I went through that coverage, what I found was that it's not George Floyd's death that set the agenda, although George Floyd's murder very clearly set an agenda with the press. But this press agenda that links coronavirus with racism, again, was widely set by a wave of protesters that included doctors and nurses that said racism was also a health pandemic in the United States. So I would argue that it took this secondary string of official sources and experts beyond just Black people dying from police violence and COVID-19 at a disproportionate rate. It's that novelty of doctors stopping what they're doing and calling attention to the issue in the middle of the street in their white coats, coming and making this connection that drives an uptick in coverage of racism and coronavirus. But it's not novel for long. As you can see, it dies again. The attention to this issue dies again, and people continue to. Let's take a turn to look at that blue line, which includes coverage that focuses on coronavirus and Black Americans. And as I just interpret this line, I just want to remind you that 1 in 1,000 Black people have died from coronavirus since the pandemic began in the United States. Here I retrieved 8,351 articles. That's 0.14%. You can see that peaks in April. The peak represents April 6th through April 12th, which corresponds with these statistics coming out that are talking about Black people and the disproportionate loss that they're facing after we start to see the uptick in deaths. The most viral coverage came from USA Today, and it headlined Black people dying from coronavirus at much higher rates in cities across the US. We don't see a major uptick immediately after the George Floyd protest that singles out the effect on Black people. Instead, we see that this over time has lost its newsworthiness, and it gradually fades to those news organizations that focus on Black and brown communities. The yellow line represents the indigenous people or first citizens of the United States. I retrieved 5,217 articles. Of those 5.8 million, that is 0.09%. Here, there is less coverage than we've seen before. So we'll see they'll see this with the case with other race and ethnicity groups. Of the peaks, the first is again, the initial reportage of the uptick in deaths in Native American communities. And the second uptick in that yellow line followed the massive support from the Irish, from an Irish donation, and from the delivery of body bags instead of personal protective equipment to a community health center treating Native Americans in Seattle. The novelty of that was what drove that uptick in coverage. Hispanics and Latinx people is the purple line there. They received even less attention. So 4,732 articles, that equates to 0.08%. The first May 25th through the 31st peak really corresponds with headlines that are inclusive of individual hotspots in predominantly Latinx communities. The early August uptick corresponds with new data suggesting that Black and Latinx children are disproportionately contracting severe symptoms of COVID-19. Another narrative with novelty because it contradicted earlier data that said children were largely spared from the disease. Finally, if you look at that black line, which is the article count for Asian Americans coronavirus coverage, we can see the attention to the targeting and uptick of hate crimes against Asian Americans driving that brief and early March peak. That's March 16th through the 22nd, you see there, when the shutdown is just happening. And for the most part, that narrative fades out, though research suggests that hate crimes continued at an elevated rate. And here, I only retrieved 1,521 articles. That's 0.03%. So I'll take this chart down now and just sort of wrap up. So as I look at the media outlets producing news about coronavirus in the United States, I might make this cursory conclusion that there's not enough coverage. 0.22% is simply not enough. And I think it's also fair to ask the question, especially as journalism practitioners and as educators and as journalists, what is enough? Certainly, it should be a conversation here and in newsrooms and in journalism education and in conversations just going forward. But my takeaways from this data, when we're having that conversation, I would like to just introduce two equity considerations. And the first is one that sort of echoes the critiques you've already heard here, that there's a dire need to place these narratives within more intersectional contexts and to highlight not just death rates, but also the disproportionate burdens that these communities bear. burdens that not only elevate the death rates now, that we will continue to elevate the death rates in the future. It's important to consider race and class, for example, the disproportionate number of people of color who serve in lower paying jobs and the front lines. As Editor Lattimore has already talked about, there's a need to consider to think about the inadequate funding of Indigenous communities. There's a need to consider the Black people are more likely to be uninsured and suffer chronic health conditions, and that's a product of racism and not a personal choice. We should commit to the idea that this is also not a partisan narrative. This is the acknowledgement of human rights and the denial of those rights for certain communities. And in the end, maximizing these intersections and coverage would help drive home more systematic effects, a narrative that promotes the more systematic effects of racism and de-emphasizes these narratives that focus on death and prime audiences to think of this as a genetic issue, because it is most definitely not. As I look through the data, I have one more additional concern, and that's related to racist people and racist ideas. The coronavirus has offered many opportunities for us to hear about blatant racism. This includes situations where McDonald's in China banned Black people, when a senator questioned the hand washing capabilities of people of color, when a police officer said it was unfortunate that more Black people didn't get the virus, with routine reference to this virus in the United States as the China virus, and the blaming of Hispanic labor workers for surges in Florida's cases and not the state's decision to open in May. Power holders, especially politicians, use racism to maintain the status quo and protect their financial investments. And because the novelty of hearing something racist, especially for journalists, or the novelty to some people, I guess that is, the media plays a part in the amplification of racist ideas, which stirs conversation and public debate, typically about the debatability of whether something is racist or not. And there's a question about, I think there's a question and a conversation to have about journalists' initial amplification of these power holders' plays and the cost of that amplification. Ultimately, if the goal is to move the needle from that point to 2%, or if you put all these articles together and exclude and assumed that they were mutually exclusive, they're not. But if you did, for a lack of just numbers, if you add all these together, you get 0.57%. So if we think about if we're going to move that needle, while we discuss moving it towards maybe 1% or whatever arbitrary number we come up with, we have to be careful and thoughtful about the frames that we push forward. We have to be careful about not amplifying racist ideas. And I would argue that we, journalists and educators and students, we have to find novelty in the tragedy of racism. We have to find novelty in the survival of racism and in the joy that can be found in the worlds of those affected by racism's horrors, if we're going to continue to find novelty in the tragedy that racism creates. So I'll stop there. Thank you for your time.
Danielle, thanks so much. I'd now like to ask Sharie if she can offer us her presentation. Sharie.
Oh, hi, everyone. Thanks so much for having me here. And my God, what a tough act to follow. 3 brilliant presentations, and to try and not repeat anything that was already said. I'm just going to bring a little bit of a contextual history around Canadian media and the way it has handled racism, or how it views issues of racism, before I get into this moment of its coverage during the pandemic. So mine is not an academic lens, it's an experiential lens. Some 15 years ago, when I first arrived as an immigrant, but to be clear, an immigrant of prior privilege, it was not at all uncommon for journalists in this country to talk about us as being post-racial. You know, I'd hear of Toronto being boasted about as the city that people actually meant when they talked of New York, for instance, or the Statue of Liberty actually embodying what Toronto and Canada already was. And in fact, white men particularly would very commonly say to me that, look, Sharie, if you and I went to the job market today for an interview, you'd just get the job and I wouldn't. And if that was true 15 years ago, then I think you would see some change across sectors, at least in middle management levels. And we're not seeing that. And so there's a lot of anecdotal fear. What I now recognize was anecdotal fragility or anecdotal fear around this idea that the other was rising and the other was getting more powerful. But I didn't recognize all of that then. About 10 years ago, you would start seeing a little bit of the beginning of the impact of social media, the amplifying of voices that had been silenced for centuries. And then that amplification had, increasingly had a ripple effect of increasing the assertiveness of people who were not activists, but now were inspired by the activists and had a platform to make their voices or their views known. But it was a slow start to the decade. And I would say in Toronto and in all of Canada, it was the Black Lives Matter stopping Pride Parade in 2016 that really shook up how we started to view racism. It really rattled the media, where, when Black Lives Matter stopped the parade, one of their demands was to ban police showing up in uniform at the parade. And my goodness, the hand wringing that followed that moment, right? And so even then, if you raise the issue of whiteness in newsrooms, something that newsrooms in Canada do not share data about, the statistics or the demographics of their own staff, except maybe at the public broadcaster, I'm not sure. Editors at that time were still saying, well, you don't necessarily need non-white journalists as long as you followed the principles of journalism, right? Maybe you'll just miss a little bit of nuance. And I think my very first column was on this. And there were tiresome discussions on, well, if you have journalists of color in newsrooms, then what percentage should that be? But they weren't asking this of what percentage of color should be white and why. That wasn't ever asked. And so if color didn't matter, if we were all colorblind, then how about we just made all newsrooms into all black newsrooms, right? But nobody was looking at it through that lens at all. And so for too long, it's been the position in a media that doesn't understand systemic racism, that thinks racism doesn't deserve coverage unless a racist incident has occurred. And even then, when such an incident occurs, it is through the lens of, is that even racism? So I know that some of this may come from a kind of timidity. Perhaps it's a hope that somebody else will call it racist, and then the journalist can actually say that, oh, so and so said it was racist, because it's such a loaded term, right? But then in reality, that's not what happened. When you asked, is something racist? It allowed the argument to be made that something is not racist at all. And so whether it was Prime Minister Justin Trudeau's photos appearing in blackface, whether it was the hockey commentator Don Cherry saying, you people, whether it was the singer Bryan Adams referring to bat-eating, wet market, animal-selling, virus-making greedy bastards, right? It turns out that in public discourse, interpersonal racism, in those situations, nobody is racist, ever. So this is a very comfortable position for everyone to take, right? We all know here that denial of racism is the default position of white supremacy, because what it essentially means when people say racism doesn't exist is that they're doing better because they are better, because they are superior. And so it's in this context that COVID happened. Now, listen, in newsrooms, we were all undergoing tremendous stress ourselves, right? It's not just in terms of the industry that is suffering, but also for journalists as people, right? We ourselves had to focus on our personal safety, juggling between family life and work life, and understanding what social distancing means, trying to offer accurate coverage of our understanding of the virus itself, what its implications are, the stories of empty aisles, what's happening at the airports, trying to hold authorities to account. So there is a lot going on. And what happens in a time of stress is that we fall back on what we already know and what we are comfortable with. This is not the time where we are expanding our intrinsic knowledge of social inequities unless we are forced to. And so in Canada, in my opinion, what happened was we fell victim to narratives that we were already in love with. And all of them created blind spots. One, that Canada is essentially a benign project. Two, that we are not as bad as the US. And three, that we have universal health care, and therefore there cannot really be racism in health. And so we began with this idea that we're all in this together, and we applied our very non-intersectional lens. And I know that this has been referenced in all the presentations prior to mine. In the early days, in February, racism was only covered in the lens in which racism is understood, which is at the interpersonal level. And that was the lens of anti-Asian racism or xenophobia, right? So once again, not systemic racism. And it doesn't mean that those stories shouldn't be covered, they should, but we understood it as separate from the pandemic. When it was declared a global pandemic, who is most affected by it? We turned our lens to, we understood that to be poor, poor people, homeless people, but not necessarily recognizing those intersections with other identities. So any newsrooms or Canadian newsrooms that had reporters who ordinarily paid attention to these issues around immigration, around migrant workers, around racism, well, they ended up at least having an ear to the ground, but they're a small handful in the total landscape. The fact is that more than 60% of what makes us sick are social factors, such as race and income. And meanwhile, data was flowing from the US, drawing a horrific image of COVID's devastating impact on African Americans, leading to Ibram X. Kendi calling it a racial pandemic within the viral pandemic. And then here, anti-racism advocates such as Beverly and migrant rights advocates and health advocates were agitating that we have this data in Canada, but that was met with resistance. So in April, Ontario's chief medical officer, David Williams, said that, no, this kind of data isn't necessary because the main high-risk groups of COVID are the elderly, people with weakened immune systems, and those with very particular comorbidities. And then he said that regardless of race, Ontario's government treats everybody equally. So there was once again this refusal to accept that systemic racism exists. And yet, in 2016, the same government had a report on health inequities. This was authored by the same David Williams, which highlighted the role of factors such as race and income in determining health. And it says, it notes the importance of data to understand these health inequities. This is in 2016. So what about then our universal healthcare? Ontario's advocates had already managed to open in our OHIP system, which is our Ontario's healthcare system, to all people, regardless of their immigration status. But what's true in policy is not necessarily true in practice. The prominent health advocate, Angela Robertson, told me back in April that she heard that if people were turning up at emergency departments and being asked to pay $500 for treatment if they were not documented. And so once there was so much push from advocates, from societal pressure, that once we began collecting data, that's when we found some of what you referred to earlier, Adrian, about 83% of COVID impacted people in this country are BIPOC, or in this province, in Toronto are BIPOC. And by the way, then obviously medical racism wasn't the only way that Black and poor racialized people were hit, right? There was this whole other aspect to the pandemic, which was policing, and policing by the society and policing by society, by police. And so the idea of who belongs unquestioningly to a public space came into, was forced into our mainstream discussion, perhaps best by the Canadian Amy Cooper in New York, who threatened to call the cops on a bird watcher because he had the temerity to ask her to put a dog on a leash in an on-leash park, right? So that was in the US, but then there were also, I'll tell you quickly of two incidents in Ottawa, right? In March 2017, there was 17-year-old Styles Lepage who went out for a walk in his suburban Barhaven neighborhood. And then pandemic rules around what was open, what was off limits was unclear at that point. And there were no signs posted in any parks. But he figured to be safe, he didn't want to be near crowds. And so he steered clear of 3 school grounds near his house and walked until he found a public park where he could shoot a few hoops by himself. But then an Ottawa school trustee she berated him. She wanted him to leave, and he said, I refuse to leave. Why should I leave? And there were other people playing soccer nearby who were not asked to leave. And then there was another incident again in Ottawa in April, where a Black man who was accompanied by his 7-year-old daughter, they were filing out of a park after a bylaw officer asked everyone to leave. But then he was the one singled out, fined $2,010 and punched in the face for refusing to give his name. And so this led to policing the pandemic, a map that tracks all of these incidents, not this particular incident. It led to policing the pandemic, which is a map that tracks criminal charges across the country to be created by criminology academics from the University of Ottawa and the University of Toronto. And surprise, surprise, they found that the enforcement disproportionately targets Black, Indigenous, and racialized Canadians. And we were, as the Canadian Civil Liberties Association called it, in the middle of an ugly ticketing pandemic. So it was only after George Floyd's death in the US, again, when something specifically racist had happened, that the mainstream conversation, perhaps tired of COVID, focused on racism. Societal pressure at that point from activists forced media, which was once again focusing on the spectacular grotesqueness down south, to recognize and acknowledge police brutality here, with the deaths of Regis Korchinski-Paquette, Aisha Hudson, Chantal Moore, DeAndre Campbell, Ijaz Chowdhury, and so many others. Then doctors were at the same time starting to talk about racism as a public health crisis. A combination of all of this finally led the media to have a glimmer of understanding of the face of systemic racism. And yet, again, the framing went back to, you guessed it, does systemic racism exist? And it allowed politicians like the Quebec Premier François Legault to say, no, it doesn't exist. And so to round this off in the total media context in which I'm speaking, it was in the middle of this, a global pandemic, and crimes unignorable, that something else happened, which is that a number of Black, Indigenous, and racialized journalists began to come forward to speak of their experiences in newsrooms. And it took all of this to happen for Canadian media to recognize that the moment had come at last for it to commit to changes or to be judged harshly by history. What they are doing about it is a whole different discussion, so I'll just leave it at that for now.
Thank you so much for that. And I think I'm just going to start by posing a question, Sharie, both to you and also Beverly, because you both touched on this notion of Canadians being committed to a kind of an innocence project, right? An innocence project. And also, Bev, you emphasized this tendency in Canada to see Blackness as not being German, not being or being an American phenomenon. That Blackness, that this kind of the invisibility of Blackness, and I'm wondering what would it mean if we were to change the frame in this country, where we rid ourselves of this commitment to the innocent project. And if we were able to kind of see the presence of Blackness, what would be the implications, do you think, for our journalism and for the media in Canada? Sorry, Bev, you're muted. You're muted.
I always forget to unmute myself. I think you first would have to actually, I don't think you can just move from the way in which your entire structure of journalism is set up to just doing that. I think you have to look at your structure in terms of how journalism is actually created, because it is created along some very clear frames that I would say the way that objectivity and facts work within a range of such discourses of universality, of exoneration, of whitewashing. All of these things shape journalism as it is. So these frames continue to be frames that you use in your journalist schools, because I've spoken to some students in journalism, and that's the frame they work from. I mean, it was only recently that I think Ryerson fought really hard to get a course, one course that actually centers racism. How do we then start thinking about race and racism as a fundamental issue within Canadian society, so that as journalists, that we learn to speak to these issues based on the fact that racism does exist in this country. And this is only one course. This is not the framing of, journalist schools. And journalist schools are very privileged, and they're very, they're seen as, journalists are seen as a privileged group, as a group with a lot of power in terms of, because they provide information, and people sit in front of their television set, more so during the coronavirus and probably in recent times, because you were on lockdown, and relied on what was coming to them from the television set, from the radio, from social media platforms as the truth, the facts. And I think it's critical that you start with reframing how journalism functions, so that you start creating an area of work that actually shifts its universalism, its sort of dichotomy, to include multiple narratives. I mean, I think power has to be shifted, in other words. Power has to be more than power that is systemic, that is repressive, top down, and there has to be room for multiple narratives. And if reporters start reporting from the basis of that there is more narratives, and the narrative should not only come from the state or particular individual who holds particular power, or who we think actually have the information, because I mean, media institutions are very much based, very structured within capitalism, and within a capitalist racialized logic. And usually when reporters report, they want to hear from who they think the experts are. They want to hear from who the leaders are. They want to hear from who the professionals are. And usually these individuals are not those who funnel information that is about the people. In fact, they're there to maintain a particular kind of discourse, one that continue to uphold particular kind of state and systemic inequalities. So I think it's really critical that you have to start challenging your own intellectual foundational canon of scholarship, and how the school of journalism actually thinks and practices journalism, so that there's room for multiple narratives, so that the only time when any inkling of the realities of Black people were coming through is when those of us were writing in alternative medias, right? Alternative platforms. We were not writing in the main media. The only reporter, one of the few reporters that I know who was covering from the voice of racialized people was Sharie in the Toronto Star. Other than that, you weren't getting that perspective. What you were getting was, the perspective of a white media, universalizing whiteness and a particular discourse. And it wasn't until we started saying, this is happening, then it entered the frame and entered the mainstream as, Blacks are now wanting disaggregated data. And now that they're wanting these disaggregated data, the question will become, everybody wants their own data. I mean, they were saying these things. And I'm thinking like, and so what? If that is the case, like, what's the problem here? We all live, we are all, there are many lives and there are many experiences.
The idea is that what makes you so special?
Well, no, but that was it. Like, why? And I'm thinking, but there's data on white men. There's data on, white women. There is data on seniors, and they all the majority happen to be white people. But there's, and the question is that not, I want to be really clear about data and the collection of data. Because in these political times, data has always been, a fraught area for Black and racialized and indigenous people, because data has been used against us when it is in the hands of, the state and other, state professionals. It's been used to target, not to actually, create sustainable policies and programs and support for communities that are disenfranchised. It's been used as a way to surveil and to police, which is why the Black community in Canada has always been particular about, data being collected on Blackness, right? And particularly data collected by police, because it has always been turned against us.
Yeah.
So I just want, I know I'm talking a lot, but
No.
I just wanted to say that, there's all these, data is not that clear either, but I don't think we were asking for data simply so that we can have numbers, but we were asking simply for the purposes of pinning down the way in which diseases and viruses like the coronavirus, as Ashton mentioned, in terms of how similar to how the AIDS virus actually impacted Black people. And we didn't know here in Canada. We were getting information on how it was impacting white gays and white queers, but white gay men had to actually collect their own data in order to actually start talking about how it was affecting the Black community.
Yeah.
So I'll stop there.
No, thank you. Thank you so much for that, Beverly, because I wanted to follow with Sharie. What would it mean if Canadian media were to adopt something I'm going to call the Bain Doctrine, right? The Bain agenda of adopting multiple narratives and changing the frame. What would it mean then for the coverage of this COVID-19 crisis? As someone who works in the newsroom, how could you imagine the way in which we tell these stories changing if we were to adopt this kind of doctrine?
That's a good question, and a practical one, right? The first thing that would have to then change is that framework of amplifying an institutional point of view and looking at institutions as the experts on lived lives, right? So the first thing that would happen is we would view, unless it was data that was collected by institutions and unless it was data collected with integrity by institutions and owned by the people who are affected, we would say the institution says this, but this is what the people say as well. And that would be the balance we would be looking for, not so-and-so says racism exists, but so-and-so says racism doesn't exist. So we would go away from that idea of does it exist to now start fine-tuning all the different ways in which it is affecting us and what we can do to, what policies, what actual actions we can take to overcome it. But none of this, I am a firm believer that in all sectors, including in journalism, no change is possible unless all of us view ourselves as individuals as sites of change. First, sites of change and learning, introspection, viewing our own identities in relation to the identities of people around us, taking an absolutely unflinching gaze at the privileges that we have relative to somebody who doesn't, and what all those intersections are, and carrying that identity with you to every interview. And so if you're a white male or a white female, cisgender and able-bodied, then you go understanding that privilege and understanding, therefore, what responsibility that privilege also means when you're asking questions, right? And it, even just simply knowing that level of awareness will change how you approach stories, will change, we should ideally cut away then that white saviorism and to be able to respect the resistance, the fight back that's coming from communities, and to give them the space and to give them the voice and to get yourself out of the equation. So it's not so much about you, the journalist, I'm going to allow you guys to speak. It is more, here is my platform, and these are all the changes, and this is how we'll hold people accountable. It is not to say that we give up our journalistic values of, holding people accountable, of being, of actually testing evidence, of just, we are not stenographers to either institutions or to activists, right? Everybody has to be held accountable, but we have to do it fairly. And so even things like known to police, question what police mean when they say, oh, so-and-so is known to police. Don't just assume, don't just speak in codes and say that if somebody is known to police, it means they are not worth covering, or it means that they deserved what happened to them. So just one simple example here.
Danielle and Ashton, we know that African Americans, Black Americans, constitute about 14% of the US population. Danielle, you cited quite an astonishing figure. I think, you gathered all of this data and you found, I think, just 0.22% of the stories that have been told about coronavirus have been told about the plight or the challenges of Black Americans. And Ashton, you cited the fact that at PRISM, you have been very, very intentional in the way in which you've been telling stories around COVID, but that you notice that so many of the stories that you are exposing, some of the stories that you are telling are not being told in the mainstream media. So I'm wondering, I guess the question first of all is, who is the mainstream media news? Like, who is news for in the mainstream media? What does this tell us about the function of news? And I'll ask Danielle first.
Well, I mean, news has always been for the majority, which has always been assumed to be white people. It's always a capitalistic entity. It is there to make money. And despite the fact that we have ethical clauses, especially in the mainstream, that try to write specific norms and routines and practices for journalists, I mean, in the end, these norms, the underwriting of them are institutionalized in a system that is thinking about capitalism and that is rooted in racism and is rooted in patriarchy. I don't think we can avoid that idea. So the mainstream pledges allegiance to these sort of foundations. And I think that, we have a bunch of media organizations, both ethnic media, that have a huge, century-long history of committing to a different cause, to saying, people over everything, people over money, right? And they committed to pleading the cause of people who were not represented in that space. Not only ethnic media does this, alternative media, which has a double-edged sword, it also, takes a stance, says, I step away from objectivity and pledges allegiance to some specific idea or topic or ideological stance, and then decides to report from that, a new revised form of objectivity that centers a particular issue. And that there's not always a win with that, especially as we think about the fake news media and the very polarized far-right media that comes out of the United States now. But those models are ones that sort of take the capitalistic entity in some cases and place instead an ideological stance that's important as its core. And I think that having, newsrooms that dedicate to that ideological stance is a lot like having newsrooms that dedicate themselves to objectivity, and that the prestige that accompanies it and follows it is unique and palpable in newsrooms that do that.
But Danielle, are these institutions, are these media organizations, are they reformable, or are they basically functioning the way they have always functioned, so that the way in which they're functioning is not a mistake, and they're just carrying out their particular project, and perhaps there's no way of changing them?
Mm-hmm. No, I mean, I'm doing trainings in newsrooms now. I don't think there's no way of changing them. I think that there just has to be constant pressure to change them. And it's hard to keep in an institution that's based on ideals that these are challenging. It's hard to keep them to keep that idea center. And so, you know, a lot of times we've said, well, journalists do this. Well, it's not just there's a lot of mindful journalists in the mainstream that know what they're doing, that know how to talk about racism and that know how to talk about racists. And, you know, that can't find their place either because they're not represented adequately in their newsrooms, or because their editors are editing out these things that they find non-essential, right? We find that editors have a problem. You keep stepping up the ladder. There's all kinds of problems that are not just journalists, but we talk about journalists a lot. And so I think that yes, newsrooms can be reformed, but a whole collective newsroom has to say, we at every single level, not just at the journalist level, not at the lowest level, technically, of our administrative, you know, spaces. We are not just going to make them responsible for making this happen. We as a collective entity, we as a group have to make it happen. So I think reform can happen.
Ashton, you talked about all the unique ways in which you were telling the story of COVID-19, the really fascinating angles. And it makes me wonder, like, what are the questions then that your colleagues in other parts of the media are not asking that prevent them from, you know, engaging in the kind of project that you're engaged in? So what's preventing them from finding the angles that you're finding?
I think it's actually a great deal of what Danielle pointed out, which is that, you know, even if a reporter, and many reporters do, you know, at many legacy outlets, have the wherewithal and the knowledge and the nuance to be asking these key questions, if that's not the way that their editors think about things, if that's not the way that, you know, the people at the top, their publisher, might think about who their audience is, or what, you know, what's kind of in their organization's wheelhouse, then even if they are asking those questions, those are not going to show up in the stories, because the stories won't be assigned, or the context will be edited out of them. But I think, you know, some of the key questions that I think are kind of missing are I think, first, who are these stories for? A lot of this is kind of an audience question, and many outlets kind of write with a presumed white gaze as who they imagine their reader to be. And it comes across in a way that flattens communities. It flattens people into one thing. You know, it flattens workers into workers, and it doesn't allow you to disaggregate them into, how is this affecting, you know, Latino workers? How is this affecting, you know, Black and brown childcare workers? So I think just asking how people's multiple identities are intersecting with each other and complicating one another in this moment, I think, is a question that's not being asked enough, very often in service of the kind of universality that I'm seeing in a lot of the stories. You know, I think that Beverly's brought up, and Sharie as well, just kind of this idea that we're all in this together. So it's all affecting us, even in some kind of individualized pockets, affecting those pockets the same way. A lot of the stories that have been about women writ large, you know, if you look more closely at them, they're actually about, you know, middle-class white women and the problems that they're facing, because, you know, it's hard to work from home with your kids at home with you on Zoom. That has nothing to do with the challenges that's being faced by, you know, a Black woman who is a housekeeper at a university and is put at risk of COVID because the university is open and it shouldn't be, and there's students running around everywhere, and now, you know, she has to put her children at risk every day. So really just being willing to hold the idea that even when you think you're breaking things down into meaningful categories, women, Black people, you know, LGBTQ folks, there are many, many more layers that are deserving of examination. And there are many, many more layers to the way that people are being affected and the way that they're showing up for themselves and their communities.
Beverly, we have a question here from the audience. It's Randy Boswell, and he says, and I'm just going to quote him here. He says, the Derek Sloan, Dr. Theresa Tam incident was raised. Of course, Theresa Tam is the medical officer of health for Canada that Beverly cited in her presentation. The Canadian mainstream news framed Conservative MP Derek Sloan's questioning of Dr. Theresa Tam's loyalty to Canada as an absolute outrage, and that his party's slow or incomplete condemnation of Sloan only aggravated the outrage. Obviously, Canadian news media outlets have much, much more to do to improve their coverage of BIPOC communities and to sharply increase the representation of racialized communities within their newsrooms. What else should mainstream news organizations have done in response to the Sloan-Tam debacle? Was there a failure in that moment to fully connect the controversy to systemic racism? Sorry, Bev, you're on mute again.
I just want to always make sure I'm not disturbing anybody else. So yeah, absolutely. I think it was, I think it was a missed opportunity to, I think what was done is that there was a making over of Dr. Tam, rather than an intervention that says, that we have to actually acknowledge where this is coming from, and that maybe we need to also pay attention to the way in which we are actually talking about the coronavirus and its link to China. I mean, the way in which this conversation was taking place was an insistence that none of the other countries bore any responsibility, that this was centrally China's fault. And as a result, that became the wallowing discourse. So what happened is that Dr. Tam had to be sort of made over in the process so that she can be rescued, but not that the issue around the fact that she was actually being framed within this yellow peril discourse, but instead she had to be rescued as someone who actually slipped up, someone who actually showed or revealed her weakness and weakness in the context of how that impacts government and the Liberal Party and the nation. So therefore she had to be made over so that we can say that actually, and she had to also, in some way, it became incumbent on her to prove, that she was committed to this state, committed to this country, committed to this nation. And that was part of the remaking of her when there was a big interview that was done, and I think it was done by CBC, and it was done by Rosemary Barton, if I'm not mistaken. And as a result, I mean, that whole process was, you had to show that you put Canada first. So I think that was a miss. I think, again, it moved to framed and restructure the white universalism of this country. The media did, rather than, at that point, start challenging the way in which we were talking about the coronavirus in the context of a yellow peril, which also allowed for a lot of attacks on Asians in this country, which was connected to that discourse of the yellow peril and the fundamental anti-Asianness and racism that frames the nation.
Following up on that, and this question is for Ashton and Danielle, Bev has mentioned the yellow peril discourse, and I'm wondering if in the mainstream media, whether we have not covered the kind of material effect of that discourse on communities enough. I was noticing that just yesterday in USA Today, they revealed that in San Francisco, 38% of those people who've contracted the coronavirus are from the Chinese community, Chinese American community. It's an astonishing number. There's a tendency to see Asian communities in the States, or Asian Americans, Chinese Americans, as being part of this model minority. There's this kind of model minority myth. The fact is, these communities are much more layered and heterogeneous than they are presented. But the fact that there's been this constant drumbeat, this constant talk about this Chinese virus, it's resulting in a lot of Chinese Americans not getting tested. They're not getting tested because they're afraid of the stigma of going to get tested. And it doesn't seem as if these stories have emerged as much as maybe they should have in our media.
I mean, my data would support that. I would say that we have not paid enough attention to Asian American communities in the United States. And that the small uptick that we did see was at the initial beginning of the pandemic, when there was a rise in hate crimes against these particular entities, again, sort of triggering what Sharie has talked about. These has to be a racist incident to talk about it. And model minorities, they don't face those racist incidents in the same way that are discussed with other people who, or other groups of color. And so my very short answer would be no, it's not covered enough.
Ashton?
Yeah, I would have to agree with that. And it's interesting tying it back to the need for a racist kind of incident. We have them all the time though here in the United States, right? The president himself is a walking, talking racist incident against Asian American people. I mean, even in the debate last night, he persists in calling this, the China virus and blaming China for it, which is the very same rhetoric that whipped up, the stigma against Asian American folks in the first place, which is contributing to their unwillingness or their reticence to get tested. So I think even being willing to recognize a racist incident against a model minority or supposed model minority when we see and hear one is something that might be missing in a lot of quarters. Because I think it gets framed in some ways as xenophobia, which it is, but it has material effects on Chinese American folks and other Asian American folks from other communities in the United States as well, because people aren't always making those distinctions when they're being racist or putting stigma onto people. So being willing to call out those incidents when they occur and then look at the follow-on effects of them, I think is something that is missing, particularly with Asian American communities.
Sharie, you've been nodding your head, which leads me to believe that you have something to add. You have something to contribute.
Not to this, I mean, absolutely there is anti-Asian, xenophobia. I do think that in the case of Sloan and Tam, the problem with the way the media looks at it is it's a conservative man saying this, and therefore conservatives who are racist. But not, it doesn't matter who is racist. It doesn't matter. That is how all of society is seeing it. You could be liberal and you could be a left-wing guy who's a white guy, and then you could still be having those opinions. So it's not a political position that one is racist, but I think it was converted into that, which is problematic.
Mm-hmm. This is just a general question, and we're going to be wrapping up very soon. But what are the dangers of seeing racialized communities as a monolithic group? And perhaps I can start with you, Danielle.
The dangers are, I mean, they're not. So, I mean, there's so many different perspectives and experiences. I mean, just intersectionally thinking about, do Black women experience the same thing as Black men? The answer is most definitely no. The way we experience being able to get sick, the way we experience having to take care of those people, our caregiving duties are different. So thinking about how Black Americans are affected without thinking about these intersectional spaces erases at least one of those perspectives, whichever one is giving more privilege, right? So, I mean, I think that the real danger is the erasure of certain subsets within a community. And I think that because we continue to think of like people with the same color skin as a community, not that we don't have, emerging identities, not that we don't share a common struggle, but the idea that we are one succinct community that like articulates something in the same way, that it continues to just be a part of an erasure that doesn't allow us to understand the intersecting identities that are increasingly complicated in our modern world.
Beverly? Sorry, Bev, you're on.
Sorry. Yeah, I mean, Daniel pretty much covered it. And I think Ashton in her conversation when she was also talking, about, intersectionalities. And I think one of the major things we know already that Black communities are not homogenous. And we know that there are multi-intersections for Black people. But one of the things that I think has become really significant also around the coronavirus is that there is a certain kind of coalescing around Blackness that also drains it, focusing on the implications for queer communities, right? Queer and lesbian and trans communities, right? Who are Black, in terms of what this means in terms of coronavirus and what is happening with those communities. Because there, even in our conversation, and I work at the intersection of gender and sexuality. So even in our conversation, while we are speaking about gender, and we're also speaking about the impact of coronavirus for queers and trans women and LGBT women, that sort of falls off. In fact, we know that this particular community is more at risk because there are actually communities that are also experiencing daily violence. Trans women are dying, at a fast pace, at Black trans women in particular, and disappearing within all of this. So we see how dangerous it is if we are coalescing Blackness around, a sort of monolith. But it's really important why multiple narratives have to always, um, um, you know, populate, because this is what happened. These aspects of our lives and of our communities get hidden, even as some of us attempt to actually talk about, the context for Black people and Black women in the context of the coronavirus.
Ashton, can you add to that?
Yes, I think one of the most important things to keep, top of mind when questioning the danger of treating communities as a monolith is recognizing the power of what journalism is and what it can do. It doesn't just reflect the world around us. It's not just us observing things and telling the truth. Journalism also moves people to action. It also shapes policy. It also informs people's understanding of the world, understanding of what's possible and what's necessary. So if we're reporting on communities as a monolith and we're missing the needs of Black women, we're missing the needs of, gay, trans, lesbian, Latinx folks. We're missing the needs of Asian American communities who aren't from East Asia. We're missing the needs of immigrants who aren't Latinx, but who are Black immigrants. You're missing a whole set of stories about the things people are doing, about what's needed in their communities, what's possible in their communities. So you're fundamentally stunting the growth of our society and the growth of the way that we think about ourselves if you're not accurately reflecting on all of the nuances and different folks within these communities that we're talking about.
And finally, Sharie.
Very quickly, I think it's very much in the interest of a white supremacist project to consider all BIPOC people as a monolith, because then when there is a difference in opinion, and you might have a Black conservative, or you might have a model minority who might dispute aspects of racism, that it allows power, whiteness, to say that, see, this person says it doesn't exist, therefore it doesn't exist. It allows that move to innocence once again.
Mm-hmm. Well, on that note, I think it brings us to the end of this session. Thank you all so much. Thank you very much for your contributions this morning. Thank you to Beverly Bain. Thank you to Sharie Pradkar. Thank you to Ashton Lattimore, and also thank you to Danielle Kilgo. And thank you also to the organizers of this conference for bringing us together, allowing us to have this very vigorous, enlightening, incisive conversation. Thank you very much, and have a good morning.
Thank you.
Really nice to have this conversation with you. Thank you.
I enjoyed it.